The strength of a society is dependent on the health of its people, from disease prevention to access to quality healthcare. Gombe State in the past 7 years has been recognized as one of the growing states that had taken care of the health of its people. And today, to talk about the reforms, the strategies, and what the government of Governor Inua Yahaya had done, we have Dr. Habu Dahiri with us. That's the former Commissioner of Health. Good to have you amongst us, sir. Thank you
Thank you
for
very
coming.
much. It's a pleasure to have you too.
Thank you, sir. So before we go fully into some of the reforms or the challenges, I want to ask, how was the state of Gombe health sector before you resumed as the Commissioner of Health?
Thank you very much. You see, in 2019 when we came, the health situation was moribund. There was lethargy among the staff. There was shortage of manpower. Infrastructure was decay, and the numbers were so small in terms of the total population. The number of health facilities were small, relative, especially the primary health care facilities. So that time, immediately His Excellency came in 2019. From the stadium, after he was sworn in, he proceeded straight to the specialist hospital. This is to show you his passion for health care, because during his electioneering campaign, anywhere he goes, you see dilapidated hospitals, low morale of staff, decayed infrastructure, and inadequate hospital equipment, and working environment was just not good. So he set up a task force, recall all staff that were sent on training and couldn't even complete, or some have completed but are practicing elsewhere, consultants, brought them back into Gombe Specialist Hospital, reactivated the accident and emergency unit, and also expanded the labor room and the emergency pediatric unit, bring in additional equipment, particularly in the laboratory, in the diagnostic area, the X-rays, digital X-ray machines, ultrasound machines, and other host of equipment. Then the theaters, he activated the theaters, both the Gani Theater and the General Theater, at the specialist hospital. Now we now selected one hospital per senatorial zone, and this hospital serve as a referral point for others, aligning primary healthcare and other cottage hospitals within the zone. General Hospital Kaltungo in the Gombe South, and General Hospital Bajoga in Gombe North. And then in the center here, Gombe Specialist Hospital. So this serve as referral points for other cottage hospitals and smaller general hospitals. If I take, for example, General Hospital Kaltungo from Shongom, from Southern Balanga, from Billiri, they are all referring cases to those places. And in Akko and Yamal Tudeba in Gombe Central, we picked General Hospital Kumo. General Hospital Kumo was in total disrepair, and the hospital was sinking because the construction was poor. So the whole hospital was demolished, and we had to start all over again. Soil testing was done, structural engineers were brought in, new drawing was made, and a new hospital came up in that place, which later on was handed over to the federal government to serve as Federal Medical Center in Kumo. In the same manner in Bajoga. Now, in primary healthcare, what we did was first to look onto three major policies, programs, projects. Now, under policies, we now said uh, there was no health management board since the creation of Gombe State. Then we established the Hospital Services Management Board. The idea was to decentralize care, to provide the welfare and appointment, promotion, and other discipline of hospital staff under the Hospital Services Management Board. Now we also established the Gombe Contributory Health Scheme. The idea is for you to achieve universal health coverage, you need to have access. Everybody has to have access to hospital, and the only way is through health insurance. So when we brought in health insurance, there was some this is from the people of Gombe State. They don't want insurance. We now said no, we're not doing insurance. We're we use one word in Hausa called Tebake Kenya, meaning
But
be our brother's keeper. Mean it's contributory. Everybody will contribute, and then money will be pooled, and then everyone will use. And it's not everybody that comes to the facility on a daily basis. So we started at Jekene Ferry Ward, which is the governor's ward. At the PHC there, the community gathered some money, pool resources together, bought drugs, and people were accessing. When they saw the result was good, and then they were expanded. So it was easy for us to now convince the people. We took a bill to the State House of Assembly, and the bill was approved to establish Gombe Contributory Health Scheme. And then we started with formal and informal sectors. The formal sectors are the civil servants. We sat down with the Nigerian labor and the trade union organizations to convince them of the benefits they are to gain when they go into the Go Health program. Initially, they were skeptical, but we told them, look, you, your wife, and 4 kids will access facility 24/7 and with the minimal service package, meaning basic care will be given to you. And you know, as civil servant, when the month is 25, 26, by the way, governor always pays his salary on the 25th of every month since his inception till date. So, but sometimes you go in, I mean, 5 people go into the hospital, one bill, you may not afford it.
yeah.
So, with the health insurance, it was easy for you to access all your I mean young ones, especially months of July, August, September. Children get sick from malaria, from pneumonias, from all this, and 4 of the children can get sick on the same day. And when you take them to the hospital, the bills become too
Okay.
enormous on you. Out of pocket. The whole idea was to reduce out of pocket expenses.
Expenses for
So the Gombe contributory health insurance was floated, and we started there. Uh, the formal sector enrollment was sharp, and because we got the buy-in of the labor and the trade unions. Then the informal sector was where we had some challenge.
okay.
Uh, they didn't understand the concept, and they were thinking it's too good to be true until we started getting testimonies from people that benefited. When they came out and were saying, yes, I was on Go Health, my wife came, cesarean section, 12 midnight. There was nobody to even convey me. Even the transport to go to the hospital was challenging. On arrival, cesarean section, mother and child all well. So the excitement came in. Everybody now was rushing, especially when we started with the public civil servants, the state civil service. Those in the local government were not in the team because their salary structure then was still in this. Immediately they approved their salary structure, they came in to say they want to join, and we absorbed all of them in the local government. Now the informal, the keke napep rider, the market woman, the trader, and the
Oh,
herdsman, and blacksmith, and
yeah.
these are the group of people that we're here to get. We have the tertiary institution in the colleges of education, universities. All that one is floating very well. Then another policy was we reject the primary health care. It was there, but moribund. So we brought in additional experts. Primary health care essentially is about uh, delivering
Yes,
services,
to the
especially
grassroots.
at the grassroots. The primary health care, the PHCs, then we now said, okay, every ward should have a minimum of 2 PHCs activated to level 2. Level 2 is a facility that has an expanded labor room, a lying-in ward, an antenatal clinic with full complement of antenatal care, a nurse, a midwife, and there must be a staff quarters. There will also be a solar, no longer on NEPA. There must be solar, and there will be water 24/7, and there will be staff quarters where the staff will be available to address any issue in the middle of the night. So that level 2 facility was established in all the 114 wards. At least I know now we have minimum of 3. There are others with 5, but there's no ward that has no at least 3 facilities that are level 2. primary health care. You're not talking about the maternities, you're not talking of the health clinics. The health clinics were also activated and were improved upon. Then, um, under the policy too, we health system strengthening, health financing, then other programs on training, retraining, recruitment, then the salary structure. Before, the health workers were not on commerce, so people were just a lot of staff were moving from the state to the federal institution, particularly the Federal Teaching Hospital
Mm.
Gombe. You see a doctor with I mean, or a nurse. The difference between staff in the state and the staff at the Federal Teaching Hospital, the salary margin, the amount was quite large. So His Excellency approved commerce and commerce. So that one also is a major policy that has brought him back. A lot of people came back because of the new wage that
Yeah,
was introduced, the commerce and the commerce.
that's
Again,
true.
again, uh, we also here you're talking about the primary health care, the government contributed scheme. Whatever you bring in, there are no drugs. The patient, once a patient come into a facility, he can see a consultant, he can get all the gadgets to diagnose him. But if he's going back home, if he don't hold drugs, you didn't do anything. So His Excellency thought it wise to establish drug management agency. And not only that, I think we're just, I mean, other here and Lagos were the first to have a business model where we now have another company called Go Pharma within the drug management agency, so that we have sustained supply of essential drugs 24/7
Mm.
in the facility at a moderate price. So we have now a way. The health insurance will give capitation to the facility. They will buy from the drug management agency, and the patients will get. So the cycle is complete.
Yes.
Not that you come the out of stock. You give consult, you give everything, but on going out, you go to the pharmacy. There's no
Yes,
drug.
that's true.
So the drug management agency ensures availability 24/7 of essential drugs that is required to
Yes, sir.
run the
Now,
hospital.
Doctor, before we continue, you had talked about some of the reforms that yes, administration had done
Yes.
as regards the health sector. I would want you to talk. You mentioned the Gombe health scheme.
Yeah.
Now, I know insurance is one way that you sort of mitigate the expenses
Out of
people would,
pocket.
out of pocket expenses as
Mm.
regards health. And health, they say, is wealth.
Yep.
You can't overemphasize the importance of people taking care of their health and all of that. For someone who is just getting to hear about this health scheme, what's the way for an individual to register or for private institutions to sort of enroll their employees in the health scheme in Gombe State?
Well, it's so simple. We made it so simple in Gombe, particularly we got digital. At the comfort of your house, there's an app on your phone. You can register in Go
Oh,
Health.
so there is actually an app
There's
for
an
Go
app
Health.
anybody can access. We establish in every local government,
Mm,
in every facility, there's a Go Health officer,
okay.
and you come and register there. Then in Gombe here, the headquarters, there's there, and then we also monitor for all the facilities that is Go Health
On that Go Health.
accredited.
Mm,
And Go Health is not only in government facilities, private health
okay.
institutions are also registered under Go Health. And if you register, you have the right to choose to either go to specialist hospital or PHC by the near your house, or a private hospital in Gombe. But those private hospitals has to meet the
The
standards
standard
we
of.
require,
Okay.
for them to operate. So there's some private clinics that are on now, and there are some public facilities that are this. So the choice is yours. Once you register, you go there, and then we monitor. We try, for example, from the comfort of my office, I can monitor a person that has been to a PHC, has been attended to, where he needs referral and is referred to specialist
Mm.
hospital, and is he accepted, is he rejected, and what's the outcome? All we can monitor through digital. Well, digital, we cannot. You have to have digital this thing
Yeah.
for you to monitor and to ensure, and that's why it is improving what the performance,
Mm.
and it's also helping us to monitor availability and of staff. The biometric system we introduce, the little stuff we have, but they were there, and the productivity. We have to also monitor the productivity. When you, it's not just coming to do the digital thumbprinting and go. No, what did you do when you come as a staff?
Okay.
So we had a scheme where we're monitoring, and that has improved to, the ministry to now know how to plan, how many people are on leave, how many people are supposed to be sent for training, how many people are supposed to be recruited the following year, or since we know how many people will retire by so period of time. All the biometric system is not just when we introduced the biometric system, the concept was not just to say, oh, we are trying to get ghost workers, or no, we are trying to save from that. It also helped us to plan,
Mm.
because the data we generate for the biometric give us how many people are there, and when they come, what did they
What they
do,
do. Mm.
so that we see their productivity, and then where are our gaps
Mm.
in the course of the day's
Yes.
work, and then how will we monitor,
Okay.
how would also monitor
So
that.
it's safe to say for every Nigerian who is based in Gombe today, I can
Can
download the app.
every Nigerian that is in Gombe, you don't need, you just ask, every facility you go to, there's a desk officer there, and you can register for Go Health.
Okay.
You can register there,
Mm. Okay.
and it's
You
just 12,500
okay?
for you, your wife, and 4 kids.
Is it a monthly
No,
thing or it's
12,000
annually?
for the whole year.
Okay.
12,500 is what you pay to register, and once you register, you will have access, your wife, and then 4 kids below
Wow.
18 years of age.
Hmm. Thank you. You also, when you earlier you mentioned that.
Because you can imagine one visit to a facility for a person that is diabetic or hypertensive or something, the bill for his investigation will even be 30,000
Mm.
one visit. But when you pay only 12,000, you now pay just a little this in for the drugs, but for the investigation and other things, you,
Mm. When it comes to the health workers
yeah.
in Gombe State, you started talking about you started talking about the reforms the
Mm-hmm.
government had made. What's the key achievement as regards the health workers in Gombe State that you can say this administration had actually achieved
Well,
compared to?
our number one, let me come, because for you to achieve all those achievements, there has to be anything without funding, you cannot achieve it.
Mm.
So number one achievement of the this of the government under health is the budgetary allocation that was jacked from when we came in. It was barely 9% of the of the total budget
Wow.
that was allocated to health. Now it's 15%, and the minimum requirement recommendation by all the United Nations systems in health and other programs in health. So for you to achieve healthcare delivery, you must allocate a minimum of 15% of your budget to health, and were able to achieve that. So because we got that, and it's not just allocating 15%, but release of 15%.
Mm.
It's one thing to allocate,
Is
and
another
it's
thing
another
to
to get it
actually
released.
implement. True.
So for us, I would say that we were able to start from 9 to 10 to 12 to 15,
Mm.
and now with 15% of budgetary allocation, release were also made commensurate to what we have made, and that is why we're getting the results. So in terms of utilization or budget, accessing the budget you have made, and then releasing it, and then utilizing the budget to achieve results,
Mm.
I would say that the budget performance, this means what have been allocated to us has been released, and that's why we are seeing the physical and non-physical
Yeah.
achievements in healthcare.
You know, Yes, sir. Doctor, when
The
it comes
indicators,
to
what I mean, if you know our indicators before, the
mm,
number of maternal mortality, infant mortality, nutrition, stunting, and immunization coverage, family planning uptake, and all these are indicators that tells you the state of health of a
I was going
place.
to go there because in the grassroots we tend to have more severe cases
Yeah.
in people in the local government in the
Mm,
villages that
mm,
seemingly can access.
yeah.
So I was talking when it comes to the primary health care, which is the system that have been designed to
Mm,
take
mm.
health service or health care to the grassroots. What are some of these measures? You started talking about the mortality rate and all of that. So what are the strategies or specific key indicators that the government had initiated as regards the grassroots
Yes,
health?
those ones are, for example, immunization coverage,
Mm,
key. We're able to review uh, immunization uptake, then we're able to conduct routine sessions, outreaches, campaigns. Now, through that, we're able to reach out to a number of children that were hitherto not reached.
mm,
So, when you reach out to those and they are fully immunized, they are now protected from those vaccine preventable
yeah,
diseases. And then death from those diseases reduce.
reduced.
Morbidity, meaning illnesses that stop them from growing properly
Mm,
or give them complications
while growing.
while growing, have all subsided.
Mm,
Then, when we also increase the uptake of family planning, that also help us to reduce maternal mortality, like I explained. Most women, when they have repeated pregnancies, then they didn't recover the children. They lose both the child and the mother
mm,
because of 1 year, next year another pregnancy, next year another pregnancy. The woman has not recovered. The child that is also born has not received the care he needs. Then
before.
malnutrition, preconception from the mother, then I mean the child that is born is also given the right diet.
Mm,
First of all, is breastfeeding. We encourage breastfeeding. We give maternity leaves,
mm,
and we encourage crèche in our workplace,
organization.
and then we educate women on the importance of breastfeeding. So they do full breastfeeding. Then on weaning, we now guide them on what kind of food. We have had partnership with ANRIN, Accelerated Nutrition for Results
Okay.
program, World Bank programs, and uh, we also made locally prepared foods. Initially, we were in partnership with UNICEF. They bring in RUTF, ready-made food, but the cost is large.
Yes.
And then we need to tell the people that within your environment there
There
are
is something we
food that you
can.
will eat,
Yeah.
and will give you the same standard of nutrition. So we now met Gari Inwa in Gombe.
Hmm.
We partnered with Ministry of Education and Ministry of Science and Technology. We produce locally available foods from soybeans, from millet, from we got the formula, got NAFDAC approval, and we produce that, and we're giving out to
So
women.
is that the food locally made mix? Is it sold to these women or is
No,
given
it's given
freely?
free.
Okay.
Her Excellency, the wife of the governor, took it upon herself, and we partnered with the Ministry of Science and Technology. We procured the this thing, we procured the raw materials, soybeans, millet, groundnut, and the proportion, add some vitamins to it. We produce them, and it's called Gari Inwa, after named after the governor. And the governor give it to children and women free.
Okay. I'm actually just hearing this. I think I'll be interested in actually seeing it.
You're
So it's
welcome. We
safe to
always can give you.
yes, so it's safe to say beyond the impact in the health sector, it has also created job opportunities. Because I can
Absolutely. That's
only
why
imagine.
when I said Ministry of Education,
Mm,
what we did was adolescent girls, those that are just graduating from secondary school, trying to go to the university, and
mm,
they would be mothers.
yeah.
So we hit two birds with one stone, meaning those group of young girls in SS 2 and 3,
Three.
we got them. We taught them how to prepare the gari inwa. So it improved their nutrition, meaning preconception, because they can also have that. Then it also try to prepare them mentally when they become mothers, how they are going to feed those their children, how they will feed their children. So when they prepare, they also go back home, prepare and sell it locally to their this. So
Mm.
we have empowered them to produce and sell within their communities and to
Mm.
also use within their
Within
homes
themselves.
to
Indeed.
themselves.
Killing two killing two
Exactly,
birds with
exactly,
one stone.
exactly,
But
exactly.
before we go, doctor,
So
I wanted to talk about despite all these
no,
reforms
but
and
there
key
are
achievements.
areas where we had stopped
Mm.
outbreaks in Gombe.
Okay.
Before there were frequent outbreaks of cholera, outbreaks of meningitis, outbreaks of measles, and since this government came into the scene, we improved the surveillance system. We know when cholera is coming, so we are proactive. We proposition. His Excellency approved. We preposition essential drugs to combat cholera before cholera outbreak come. We also preposition essential drug to combat meningitis and measles. So we do active surveillance. We move into the field. We identify cases before the number reach the
Rise.
epidemic threshold or outbreak threshold. We are alerted and alert, we move into those places. So the surveillance system was so sensitive to identify cases on time and respond and crash the situation before it spreads out. Like for cholera, there was a time that 2 3 years we didn't get one case.
Mm.
Before cases were so much, so we now went all the wells. We chlorinated all the wells, all the water ponds, all the this. We educated the people, and we know the period when the water shortage becomes acute. And during that period, we were in the field to make sure water is safe because contamination of water is the source for
For
cholera. The
cholera.
same thing in meningitis. We know the peak period between the months of March, April into May, the heat. Then we do a lot of health education and communication. We do a lot of vaccination. Once you vaccinate, then the person is protected.
Mm.
Then again, the same thing, um, Lassa fever was very,
Mm.
very pronounced in the sub-region.
Mm.
Adamawa, Taraba, large numbers. Gombe, because they are referrals, we're able to pick them. But we're being very proactive here to because our surveillance system, we are going into active surveillance, identifying early and managing. We get the cases, but we're able to manage them and they recover. Mortality is
Is
low.
reduced.
Mortality. Most of the deaths in Gombe are referred cases that came from other places. But for us, we're able to monitor people, pick the case very early, treat the cases on time, and do a lot of immunization.
Thank you so much, Doctor. I know if we have more time, there is still a lot to talk about that the government have done. But we just want to say,
Just yesterday,
yes, sir.
last week, we got the best in Nigeria in terms of public hospitals.
Wow.
Gombe was the first best in Nigeria in quality of care to citizens in Nigeria. Not only that, when they win the leadership award, the best in primary health care, the best in innovations. And part of the innovation, the biometric system, the way we also handle the health insurance, different from how even the national health insurance is operating.
Thank you so much,
So
sir.
we got a lot of best in the country, not just best in the sub-region.
In the whole
Health
country.
financing, we are at Chatham House, London, where the assessment of health financing was done and how Gombe performance was.
Thank you so much. You've indeed done a lot for the people of Gombe State. You know, they say prevention actually is better than cure. And it's good to know that there is a government that is mindful of the health of its citizens. Unfortunately, that is all we can take in today's episode. Thank you so much, Doctor, for coming. I'm actually hoping to see that Garin Inua.
Yes, I'll bring it to you
Thank you.
personally.